Welcome to SkinCast, the podcast where we dive deep into the world of aesthetics. SkinCast is proudly brought to you by Ceraderm, a leading distributor of advanced aesthetic solutions. At Ceraderm, we're committed to empowering aesthetic professionals with the tools and knowledge they need for a successful practice. Each episode will bring you expert interviews, success stories, and practical guidance to help you maximize your ROI, achieve the best clinical outcomes, and keep you informed about the latest innovations. So sit back, relax, and get ready to unlock your practice with SkinCast.
Welcome to our latest episode of SkinCast. And again, we've got a really exciting guest from overseas. Dr. Andrei has come all the way from Bucharest, Romania.
Thank you for the invite.
What is exciting is, we had a chat earlier off screen, and we talked about our passion for CO2 lasers. So I'm really excited for this episode because CO2 lasers was my early days, and those who follow me and my background, my first laser I was involved in developing was a CO2 laser, where we used to use it for ENT and gynecology. So I'm really looking forward for you to be able to share some of your experiences on CO2 and to break the myth of the CO2, because I think CO2 is really misunderstood.
Yes, I also think that. But what really impresses me is that this first CO2 was invented in the 60s.
Yeah.
So if you think about the CO2 is the second most used device, the second that's been around. The first one was the dermabrasion device.
Yeah.
And the second one is the CO2. So if you think about it, this is a device that is almost 100 years old, that it's still the gold standard when you talk about skin rejuvenation.
Yeah, and I think that, I share your passion and excitement. I agree, CO2 is the gold standard. We were using them years ago in my early days when I first got into lasers for gynecology, laparoscopy procedures and ENT. And then we saw the development and sort of the whole then CO2's taken off for skin rejuvenation. And then they fell out of fashion, certainly in the UK. And now lately they're coming back. But again, I think they're a little bit misunderstood.
Yes, they're misunderstood because it has some vendetta of facial carbonization that is totally misunderstood. You can do skin rejuvenation with the CO2 and have a short downtime. It is possible, and you can have also great results. Of course, you might need a few more sessions, but it is doable, it is manageable. And I think if we are comparing the rest of the devices, of course, the CO2, it was very up to date, and it's also now up to date because everyone is starting to come back to CO2 because you cannot do surgery for skin quality. So even if you operate, even if you do operation like facelift, like fillers, minimally invasive procedures, you cannot do skin quality with them. So you need a facial device that gives you the rejuvenation of the skin. And for me, I think you cannot use chemical pills in this century when you have so many machines that you can use.
So I guess we talked off screen about this, and I think you made a really good comment about the images that some of your patients saw over in Beverly Hills, saying, "Oh no, I don't want a CO2." Yeah. So first of all, how do you break through that barrier?
Well, it's a little bit hard to convince them after they start seeing these kind of photos because unfortunately, with social media nowadays, the information can be filtered. So the first thing they see, it's the feeling that is penetrating your mind, and you think that, oh my God, I'm going to burn my face and I won't look the same. I will scar myself and so on. So I have to tell them. I show them pictures of other patients that have done the treatment. If they're older patient, they trust me, and the job is much easier. Yeah. But I explain them how the CO2 works, essentially, because I think the transparency between the doctor and the patients should be at the highest level. And I'm telling them that the CO2 isn't the magic stick. So your body should do the heavy work. The CO2 precisely is doing a damage, a local damage, a beam that penetrates the skin, and it does a wound that is going to be healed by your body. And we can put an energy so that the beam won't harm that much.
So perhaps you could explain a little, perhaps more detail in exactly what is the CO2 laser and how does it work? How does it stimulate collagen? What is the absorption characteristics?
So with my patient, I'm not entering the pretty much engineering type of explaining them because they won't understand. And
it's my science background.
Yeah, and especially when I'm trying to tell them as scientifically as possible, I'm not making myself understood. So what should anybody know about the CO2 is that is giving a controlled burn, a small column, microcolumns around your skin, which are precisely at the same distance from one another, which is going to make a wound that is going to be healed properly.
So we know that when you create a wound, the body will stimulate collagen.
And the body will stimulate the collagen. And then, of course, I'm telling them that they should wait, because this is a key information that is not going to happen in 2 days.
Well, it doesn't. I think it takes about 3 months to build.
It mainly does. It's a controlled burn. We have a microcolumns of beams that penetrate the skin, and we can control this penetration. It's not like in chemical peels when you don't have any control around it.
And you're controlling, I guess I know the answer, but you're controlling the penetration depth by the amount of energy you're setting.
Exactly. And in CO2 we have the joules and the watts. So when we have the higher watts, we have a deeper penetration and a more narrow control effect of the beam. So then we do this treatment, and what it does, it will build collagen. But it will build collagen in a few months, not in a few weeks or days. Of course, they see the improvement right after, because they're extremely happy after the CO2. But they want more, and they come to the clinic after 1 month and say, "Doctor, I want another treatment." But
do you offer the second treatment after the month, or do you wait a bit longer?
I wait a little bit longer, because there's a lot of clinical studies that showed us that after a CO2 you have at least 3 months of developing collagen. So it's better to wait at least 2 months than do it again.
Yeah, well, I know our studies at the university showed that the collagen levels are maintained
for
up
very
to 3
long
months,
time.
and we were showing how we use vitamin A to improve and the longevity of that as well. So that's quite exciting. Obviously, from my early days of using CO2 in ENT and gynecology, we would just use a handpiece. But I think one of the great innovations has become the scanning technology. Perhaps you could explain a little bit more about the scanner and why it's so useful in your practice.
When we are talking about the fractional rejuvenation, the scanner is the most important thing on the device. Of course, the device should be at its best, but if you don't have the scanner handpiece, that it's very advanced technologically, you won't get the best results possible, because when the scanner will let you choose all the parameters that you need, the length of the square, or the triangle, or the round shape. You can alter the distance between the lenses and the skin. And that is also extremely important, because the closer you are to the skin, the deeper the penetration is going to be.
So the scanner allows you to change all the shapes and densities to maximize the clinical result.
Yeah.
I don't know how you do the procedure, but I know that if I'm training someone in the UK, like for instance my wrinkle, I would go in there with some deep energy just in a line or a small square. Then I would resurface then over the top at lower energies to go more superficial. With a bigger size, I could blend it in.
It's very, very useful, and also the possibility that lets you choose the diameter of the square, let's say, it's better for the thermal effect of the device, because if you use a larger the square, you're going to have a more a thermal effect, which is bad. So when you use smaller squares, it's much more better, because it won't hit the skin as that much. So you're going to have the damage that you want, so the skin will bring collagen.
And I know that I'm familiar with the Eco2. With the Eco2 system, you have different modes. You have a continuous wave mode, super pulse, and then you have a char-free mode. From a technology point of view, CW is continuous wave, super pulse is millisecond pulsing, and char-free is microsecond pulsing. So those technologies, when would you use them, and for what applications? And do you see a big innovation in having char-free treatments?
So when most of the time, if I want to cut a large thing, let's say a big seborrheic keratosis, let's say I will use the continuous wave, because it helps me, it has a lot of power, then it won't stay as that much. But if I'm having a small lesion, especially around the face, I will use char-free. Because I love char-free, and I don't think you'll find, probably you know best because you're an engineer, and I didn't saw any char-free models on other devices.
Well, I think very few devices have having the power to deliver it in microseconds, and it's that constant microseconds on and off that allow you to be able to remove tissue without very little thermal damage.
Exactly. So this helps especially on patients prone to hyperpigmentation, because if they have skin lesions around the face, you want something that won't bring the heat, because heat means unnecessary inflammation. So you want to have as much as possible low unnecessary inflammation. Okay, the inflammation for the skin penetration, for the beams that gives you collagen, okay, that's good, but around the lesion you don't want that, because that can give you hyperpigmentation.
And then I guess continuing with char-free, I mean, one of the questions I get asked all the time is, the trouble with CO2, there's too much thermal damage. I much prefer to use a 2940 erbium laser. For those who are new to lasers, 2940's got the highest absorption in water. But for me, I think I can do everything with the CO2 I can do with these. I don't know if you've got any experience of that. What would you say about that?
I have the same opinion as you, because you can do exactly the same things with both of them. I think also the CO2 is more practical than the erbium, because you cannot do surgery with the erbium, if I'm right.
Yeah.
And you can do also a very soft CO2 that it's exactly the same like the erbium.
Yeah. Well, I think if you use a scanner, low power. I mean, sometimes if I want to get more superficial absorption, I can slightly wet the tissue to get really superficial absorption. And so I think with the CO2, you can do everything you can with a 2940 erbium. But with the CO2, there are conditions where you need thermal damage to stimulate collagen, and you can't do that. So what you find is then a lot of people that offer 2940 erbiums have to mix it with a non-ablative laser to get the thermal damage. And I think it's one of the things that people just don't understand about CO2s.
Yeah.
So I guess another question then would be more about the parameters themselves. So if someone's new to CO2s, what would you say they should look for, are the qualities they should look for? Now, I think they should go on my website, because I've got a whole course on what to look for when you buy a CO2. But what would be your opinion on that? What are the core parameters they should look for?
For me, the first thing is the science behind it. Also the durability of the machine, because mine hasn't broke in 4 years. So,
wow. So 4 years you've had it, you haven't had a single breakdown?
No, not even the lens has changed, which is for a CO2 who does that kind of smoke, it's a big deal.
Well, and people never talk about the laser tube running out, and I'm sure reps never talk about the expense of that.
Exactly. I haven't changed nothing in 4 years. Not a single piece of equipment I haven't changed in the device. So it's extremely reliable. It's not a machine that you have 10 patients that are coming to the clinic today for a CO2 and the machine break down, because
it's important for your
extremely
reputation
important.
as well.
Yeah. And besides that, an extremely important thing is also the safety, because when you put the parameters in the machine, then the machine follows.
So, you've talked about the reliability, safety, and I take away from what would be like other core parameters that you would look for. Like if you're looking a spec in the machine out, what's the spec? What is your ideal spec that you look for?
What I do love about the Eco 2 is the scanner. The scanner is very precise, and by the way, you know better than me that scanners break down. Okay. So you want a scanner that is very reliable. And another thing that I love about the Eco 2 is the chaos factor, that you can have the random pulse.
Yeah, I think that makes a big difference from a thermal damage point of view.
Yeah.
For those who are not familiar with chaos technology, it means you can put pulses down randomly rather in a line.
Exactly.
And that makes a big difference.
A huge difference. Yeah. Because you have one point in a direction and the other point in the opposite direction, and you can have some milliseconds for the skin to cool down. So when it's linear, the heat is building up in the same spot. So probably there is going to be a hyperpigmentation. I'm always using the random chaos mode.
Okay. And do you ever, I know that on the scanner you've got a 120 micron spot size, which I think is really small for the CO2, and then you've got 300 and 500. I've only ever used the 120. Have you ever used the 300 and 500? And if so, what would you use them for?
The 500 never.
Okay.
Not even once. I think 80% of the time I'm using the 120, and sometimes I'm using the 300 because I think it works great for dyschromia patients. If you are treating hyperpigmentation that is not melasma, but because melasma is more difficult to treat, it has remembering cells for the pigment, and it always starts to come back. If it has a small hyperpigmentation that it's on the upper levels of the skin, it works fantastically if you use the 300 handpiece, because it will give you exactly what the erbium device can do.
Yeah, and I know we're running out of time, I think, but there's so much I've got to ask you. But one of the things that often comes up as well is I'll get asked a question, because we have this open chat that people can email me a question. I'm looking at an XYZ CO2 because I can fire through a burn scar in one pulse. What would your answer be to that?
You can do the multiples, because you can stack the pulses in the same spot and do the same thing. So you can also use the Eco 2 in a burn unit if you like. So
for those who are not familiar, the multi-pulse allows you to put energies in, and the CO2 will stop at a hole and it'll go further, so you can stack the pulses to go deep. So, I mean, I remember that when I was asked this last time, my simple answer was, so how many burn scars do you think you'll see? And it was interesting, the clinic said, well, we don't see any, so why would it be an issue?
So we should talk about the fact that these kind of devices usually are suitable for burn units, not for private clinics or for aesthetics clinics, because you don't need that much of a power. So, of course, if you have 3 patients a year, you can treat them with the Eco 2, but you won't need that power besides that.
Well, it's been an absolute pleasure talking to you today.
Also, thank you for
I've really
the
enjoyed it. I would like to follow up on those who follow us. I think it would be really good if we do a webinar together.
Sure.
Because I think there's so much. CO2 is my passion. I can feel it.
Yeah, also mine.
And it'd be really good to do that in the future.
Sure.
Thank you very much.
My pleasure.